Allegations of systemic racism in our healthcare system are growing louder, and we are seeing it play out in COVID-19 testing. An analysis by ABC's 538 and our own data team looked at the number of people living around testing centers and the potential number of patients those centers have to serve, and found disparities between mostly white, Black, and Hispanic neighborhoods. Action News investigative reporter Chad Perdelli explains.
The analysis found that only 3 of the nation's 50 largest cities have a greater testing disparity than that here in Philadelphia. People who live in mostly Black and Latino neighborhoods find it more difficult to find testing sites and wait longer to get tested. Our analysis of the sites active in mid-June confirmed this. In Kingsessing, a southwestern neighborhood that's around 80% Black, there's only one COVID-19 testing site, and that site has limited testing hours. Meanwhile, in the Center City area, there are many, some within a short walking distance of each other.
If you've got a good PCP, that's at a good hospital, and you have good insurance, and most often an affluent neighborhood, then you have that access. But if you don't, you can't get it.
Now I'm going to turn it.
Dr. Ayla Stanford saw the struggle and acted, launching the Black Doctors COVID-19 Consortium. Her group has administered 7,000 tests, and unlike many citywide sites, the consortium has medical professionals of color administering the tests.
People want to see doctors that understand their experience, understand their challenges, and in some ways look like them.
We know that wealthier people are much more likely to have a usual source of care that they can go to and ask for a referral, while people with fewer means tend to rely a lot more on emergency care when it is more complicated to get that referral.
Drexel University epidemiologist Dr. Osama Bilal has been tracking access to testing since the outbreak first began. He says testing rates for minorities were poor in the beginning, but improved. He worries the city is starting to regress. But Health Commissioner Dr. Thomas Farley disagrees.
Our numbers so far look like we have reached them. We have numbers on our website, and I think that we have about twice as many African Americans as whites who were tested so far.
But that data is compromised, with more than 49,000 tests on people of unknown race. Still, Dr. Farley says the city has been working with groups like the consortium to reach underserved communities. And he says this map detailing the various testing sites across the city shows largely minority neighborhoods like West and North Philadelphia are well represented.
I think so far we've done fairly well in trying to make access available with the resources we have overall.
And Dr. Stanford tells me this would be her solution. Various hospitals geographically located across the city would have one day each week with long testing hours, free of referrals and appointments. In Center City, Chad Perdelli, Channel 6 Action News.
Thank you, Chad. You can get more on the details of this report by going to 6abc.com. You can also find out how Philadelphia compares to other American cities in terms of testing.